class, Instructor Asbury here. Let's go over your discussion this week on claims processing and the specificity. The purpose of our discussion this week is to apply your knowledge of medical terminology and the disease process. And with that, you're going to evaluate an assigned ICD-10 code. After a medical claim is submitted, the insurance company determines their financial responsibility for the payment to the provider. This process is referred to as claims adjudication. The insurance company can decide to pay that claim in full, deny or reject that claim, or they can also reduce the amount paid to the provider. When an insurance company decides to reduce a payment to the provider, they have determined that that billed service level isn't appropriate for the diagnosis or the procedure code that they were given. Therefore, it is important to ensure that all of your claims submitted for payment are coded accurately. As soon as the insurance company receives a medical claim, they begin a thorough review. Sometimes even small errors like a misspelled name, patient name, can cause the claim to be rejected. And then this delay prevents you from receiving payment while those corrections are made and then it's sent back in. So make sure that you submit a correct claim from the get-go. Insurance companies will provide an explanation of benefits to the provider. This will detail all the information about the claim. If a claim is reduced or denied, you'll find your answer here on this EOB. When I was working as the Director of Reimbursement, we saw claims denied for a variety of reasons. If the ICD-10 code is not coded at the highest level of specificity, your claim will be denied. Let's look at an example of that. Let's say that your patient has a diagnosis of malignant paraganglioma. Now you're going to start in your alphabetic index of your coding book and you're going to look up paraganglioma and then the subterm malignant. Now once you get there, it's going to give you a code of C74.1 with a dash. Now let's just say that you stop here and you add C74.1 to your medical claim. If you did that, you would not be coding at the highest level of specificity. Here's another reason why you want to make sure you always turn to your tabular list and verify the code. For one reason, we see this dash, which does tell us that there is other digits to be added from the tabular list. So let's go back to your tabular list in your ICD-10 manual. Find C74.1 and you see a red stop sign by that code. That also tells you that that's an incomplete code. So our choices there are C74.10, 0.11, and 0.12. And the differences between those codes are 0.10 is an unspecified, 0.11 is of the right gland, and 0.12 is of the left. So since we don't have any specification as to whether it's the right or the left, the correct code there would be C74.10. So you want to make sure you code to the highest level of specificity, and you also want to make sure that your documentation supports the code that you choose. Medical necessity documentation, or the lack of it, is one of the most common reasons for claim denials. For a service to be considered medically necessary, it has to be reasonable and necessary to diagnose or treat a patient's medical condition. According to Medicare.gov, medically necessary is defined as healthcare services or supplies needed to prevent, diagnose, or treat an illness, injury, condition, disease, or its symptoms that meet accepted standards of medicine. For example, if the patient came in with a fever and a sore throat and your office billed for a urinalysis, then the insurance would not pay for it. This is because it is not medically necessary to perform a urinalysis on a patient who isn't having any urinary symptoms or problems. If a patient has a suspected urinary tract infection and has a fever and a sore throat, then the doctor might perform a urinalysis as well as a strep test, and then we would have documentation, the fever, for the urinalysis. The coder has to link the correct diagnosis, the urinary tract infection, with the correct procedure, the urinalysis, in order for the insurance company to pay. If the coder doesn't link those procedures with the diagnosis correctly, then the insurance will deny those procedures and not pay for medical necessity. Make sure your coding matches the medical record documentation. If it wasn't documented, it wasn't done. So we can't bill for something that was not documented. Make sure you answer all parts of the question in the discussion this week, as well as all parts of the discussion in your replies to your students. If you have any questions, give me a call. Thank you.